Janet Atieno nurses her newborn twin girls at their home in Kisumu City in Kenya's Nyanza province. Apio and Adongo were born prematurely on February 2012 at only 30 weeks gestation. Janet suffered from childbirth complications and her newborns had to be incubated for 2 months before they could go home.
Mmoja alikuwa na 1.2, wa pili alikuwa na 860 grams. Sasa walikuwa kwa nursery kama bado mimi pia niko mgonjwa.
Janet is grateful for the maternal care she received at the new maternity wing in the new Nyanza General Hospital that kept her and her daughters alive. The maternity and baby unit were constructed with the support of the government of Norway and Kenya in partnership with UNICEF. More than $600,000 was invested in the construction of this facility to offer expectant mothers and their newly born babies quality maternal and child health services. This health facility will go a long way in addressing the high child and maternal mortality rates in Kenya, especially in Nyanza and Western Provinces.
Nyanza accounts for the largest number of children who are dying and under 5 mortality. For every 1,000 live births in Nyanza, 149 children die under 5. And in Western, for every 1,000 live births, 121 children die.
At the new maternity wing, the health workers are hard at work trying to improve maternal and child survival indicators by offering efficient and effective health services. The wing offers 20 beds for expectant mothers and 40 beds for the newborn babies with support facilities such as doctors' offices, nurse stations, mother's milk express room, and much more. Before the maternity wing was constructed, mothers were often forced to share the beds with other expectant mothers due to lack of sufficient space. Rose Odhiambo lies on her bed waiting to deliver her baby. This is her second pregnancy. Her first delivery at the old maternity wing was not as comfortable.
Last time tulikuwa unalala hivi, mwingine ameangalisha huko kichwa. Hata kama huyu mwenye amezaa, yeye amezaa mimi sijazaa, but yeye analala hivyo mimi nalala hivi. Lakini saa hii uko peke yako kwa bed. Hakuna ati mnafinyana ama nini. Saa hii nafurahia.
In addition to this, a further 19.2 million Kenya shillings, equivalent to close to $230,000 was invested in new equipment and furniture. Jane Mirongo, the nursing officer in charge of the maternity and newborn unit, feels more motivated working here. She is currently undergoing further training alongside her colleagues on how to use the new ultrasound machine. This project hopes to further facilitate the training of highly skilled nurses, midwives, and interns.
The customer care relations of this hospital, and especially labor ward, has improved. So actually, if you're working in such an environment, the staff is highly motivated.
The newborn unit is also a flurry of activity. This unit cares for premature babies who were born before 37 completed gestation weeks. The nurse in charge of the unit, Betty Juma, is doing the rounds and checking on the newborn babies and their mothers. Though some of these children have been abandoned by their families or lost their mothers during childbirth.
Previously, we were in the older building, and the unit was so tiny. We only had 3 rooms, which was squeezed both to the mothers and the staff. But now with the new building, we are really comfortable. We have spacious rooms, new machines, and the mothers are very comfortable in this unit.
It was in this unit that Janet nursed her premature babies back to health before heading home, and she has some advice for all expectant mothers.
Hata watoto ningelose, ningezaa kwa Nyamrerwa. Lakini uzuri nilienda hosi, nikaona uzuri ya hapo. Sasa bado ninaomba tu watu wengine pia wakuwe tu kama mimi. Waweze kufika kwa hospitali wasaidiwe.
We have noticed so far that mothers are now not even going to Aga Khan. They prefer to go to the Nyanza Provincial Hospital, and we think it's a good thing because it takes care of the women who are vulnerable out there.
UNICEF continues to work with the government of Kenya and partners and is very grateful to donors who want to improve the health and welfare of mothers and children in Kenya. Daisy Serem reporting for UNICEF Kenya. For more information, go to unicef.org. Unite for Children.